Good afternoon, everyone, and welcome to our next session. I'm delighted to be able to introduce Aerts, who is the head of the Novartis Foundation at Novartis. She will be having a discussion with myself around reimagining healthcare delivery and access on a global scale. So I'm just about to kick off the conversation with Anne, but before I do, just a reminder that if you do have any questions for Anne during the presentation, please do put those in the Q&A function on the platform, and Anne will either answer when she's able, or she can answer after the session has been completed. So without further ado, Anne, welcome. It's an absolute pleasure to have you here.
Thank you, Becky. It's a pleasure to be with you.
So just to sort of kick off then, I guess, I mean, obviously everyone, is familiar with Novartis, I'm sure, perhaps not so much about the Novartis Foundation, but, what are the key challenges that, surround healthcare access, and how can digital and obviously the Novartis Foundation help?
Yeah, Becky, I think the challenges we face in the world nowadays, the global health challenges are really unprecedented. We have this huge shortage of healthcare workers, which is one big problem, specifically in low and middle income settings. We have a very rapid urbanization rate that most of the people already do live in cities, but by 2030 or 40, there will be like 70% of the population in the world living in cities, and the infrastructures are not prepared to address the needs of all of those people. And at the same time, health systems face this dual burden of disease. There's this unfinished agenda of infectious disease, specifically in low and middle income countries, but also a very rapidly increasing number of people with chronic diseases. And health systems are not geared towards addressing chronic care. They are much more geared towards giving acute care in low and middle income settings. And lastly, we live with this constant threat of new emerging diseases, as we just realize now with COVID. So it is just a call for all of us that our health systems have to really transform themselves from being these reactive systems waiting for people to get sick and present themselves, to become proactive, to become predictive even, and preventative in the end, so that they are real health systems that keep their populations healthy. And that transformation will help us reimagine, as you said in the beginning, reimagine the way we look at health and care and deliver the services in the world. And that's in fact our goal at the Novartis Foundation. So the foundation is a philanthropic organization funded by Novartis, and our goal is to advance data and digital-driven approaches to improve population health, and specifically for low-income settings. So how we do that is both on a policy level and by working with governments hand in hand and with other partners on the ground in different countries.
Brilliant, thank you. And so how sort of, I don't know, examples or real life case studies, how has Novartis Foundation been able to support these low and middle income countries in, advancing their deployment of digital and AI in their health systems?
Yeah, we worked since, in fact, in all of our operations, digital has been an underlying enabler for transforming health and care. But since a few years, we also work at the policy level. So we have operations in different countries, and I'll give you some examples, but also we work at the policy level to help and guide countries to be better prepared to deploy digital and AI-driven solutions in their health systems. And that work is specifically done through the Broadband Commission for Sustainable Development, which is the UN organization chaired by ITU and UNESCO, with all the major tech players also in there. So it's a public-private organization. And we are the only or main health voice there. So I chair the working group on health in the Broadband Commission. So there we've been working since now 5 years to develop these recommendations for countries to really tap into the potential and realize it, to address all the needs they are facing. But last year, we specifically looked at how AI can help countries really transform themselves to become true health systems, to have true health systems instead of these reactive care systems. And we were very surprised by seeing that in fact, AI already has an enormous impact on the ground, also in lower income settings, not only in high income settings. We know AI from the clinical care here in our countries already, how image-based diagnosis has been improved and helps radiologists or pulmonologists or dermatologists or pathologists to make more faster and accurate diagnosis. But we've seen in the world that AI is really an enabler for better population health decisions. And you can imagine how important it has been in the beginning of the COVID epidemic. In fact, AI, the blue dot was the first algorithm picking up that there was this cluster of unusual pneumonias in China. It was faster than people to identify that problem. So we see that AI has then helped to better plan where or foresee, not plan, but foresee where the epidemic would spread, and then help the governments plan for their actions. It's not been perfect, but in fact, COVID has really transformed our view of how digital virtual care and artificial intelligence can be really true enablers. Even the most skeptical amongst the health professionals have been really taken over the line because they saw that the benefits of providing virtual care far outweigh the risks of when you have a problem like COVID. So these elements in that landscape analysis, and there was also a view on how it enables us to discover and develop new drugs and new therapeutic options much faster, but also how it helps us reach patients or identify patients faster with chatbots and patient-facing solutions. And not only the chatbots, but also scores that can help policymakers risk stratify their populations better, for example. And lastly, AI is tremendously active in optimizing health system operations. You can plan your human workforce, your supply chain, all of the elements that are the logistics can be automated in a health system, but also fantastic tools can help identify faster cardiac arrests, even on the phone by your voice, for example. Corti has provided that example where the solution driven by AI identifies a cardiac arrest on the voice of the caller in 40 seconds or something. And if you have a human caller responding, it would take minimum 1.5 to 2 minutes to recognize a cardiac arrest. And if you have an arrest, of course, every minute counts. So all of these beautiful solutions, and another one in China, which I forgot to mention, but is really amazing, the Ping An Good Doctor. It's a platform based on Chinese insurance that wants to offer a doctor to every family in China. And they already have over 300 million users with delivering 1 billion consultations a day. Can you imagine what a huge undertaking? And that's all based on their 24/7 services in a network of internet hospitals, health centers, and pharmacies. So it is really a solution or an enabler to address the burgeoning needs of the aging population in Asia, for example. But yeah, based on that landscape, we then guided countries and distilled the insights from all the successes into a roadmap for countries where they have to really invest in to be ready to deploy AI in their health system. And that is a roadmap we are now rolling out and testing with many governments around the world. And it will help them really pinpoint, do I have to invest in my infrastructure? Because in the end, you need connection, and still half of the world is remaining unconnected. We need to really accelerate that. And that's the call of the Broadband Commission as well to all governments to make sure their populations get connected. But you need data, obviously, we know that, but that's not the only problem. A main issue is that the capacities of people and workforces around the world needs to be upskilled. In fact, data science and digital skills have to become part of all educational curricula as well, if we want to be ready to really use and exploit the potential of data and AI in our health systems. And then, of course, you need to invest in the governance and regulatory systems, but also in unique partnerships because you can never do this alone, either as a private sector or a public sector. You cannot drive AI in the health system on your own. It has to be a combined partnership. So all of these different elements have to be considered by governments. And that's what we do at the policy level. So we then also help governments to use those guidances to become more mature in their readiness for deploying AI. And this is a long answer, Becky, but would you like me to give some concrete examples of what we've been doing on the ground as well?
Yeah, absolutely. I was going to say, I mean, that's fascinating, sort of, how involved you are, and obviously the, the decision making and the policies. But yeah, if you can give some examples of, sort of digital and AI sort of practices around addressing, obviously, these various issues. And, you mentioned obviously COVID, the pandemic that, everyone is still in the midst of at the moment, and, how these new digital technologies are obviously addressing that situation in the sort of low and middle income countries.
Yeah, definitely. So at the foundation, I mentioned we really use digital as an enabler to innovate the way we deliver health and care, as that is really needed around the world. So we did that already a long time ago. And one of the first examples was really a model that is very mature now, telehealth. But at that time, like when we started 8 or 10 years ago already, it wasn't really developed so strongly. And we did that in Ghana, for example, where we connected village workers, who are non-skilled health workers, but who are often the only contact with a health system that villagers have if they live in remote areas. So we connected them with experts in maternal care, or surgeons, or more experienced nurses and doctors in the reference hospital by teleconsultation. So it was providing guidance to the village health worker to guide them through their patient care. And it was a model that was based on the local infrastructure, just a phone call at the time. Afterwards, we included WhatsApp and all of that, and images, obviously. But it was tremendously successful in the sense that even at that time, this telehealth consultation could reduce unnecessary referrals to the health centers by 30%. So pregnant women who would otherwise have been referred because they face a problem during pregnancy may very well need rather to be kept at rest and at home. So we could avoid 30% of unnecessary referrals, and we could solve 70% of all the calls. Of all the issues in the calls, we could solve it by phone. So that was tremendously successful and has become the national telemedicine service now. After a few years, now already since 3-4 years, it is the national telehealth model. So that's our first experience with that. But afterwards, we realized that in the countries where we work, there is not such a thing as a full-fledged digital system. So you have to take low-hanging fruits of how you can improve the system with some simple solutions. And at first, we, for example, introduced in Vietnam that we needed to decrease the burden on the hospitals there. If you walk through the hospitals in Ho Chi Minh City, you have the corridors are full with patients just waiting to get tested or to get their blood pressure measured, because there is no other way to do this. So what we did, and that was all in partnership with the local authorities and our partners on the ground, we really looked at how can we get that population out of the hospitals. So we screened through shops, through barber shops, manicure salons, supermarkets, and obviously also in the pharmacies, in the marketplaces, bus stations. We trained those shopkeepers to do a proper blood pressure measurement with an automated system that would refer those screening positive immediately to the health system. And then they were followed up for their diagnosis confirmation and treatment, obviously. And that system really was tremendously successful with engaging these small enterprises or big enterprises. It is very possible to do that outside of the brick and mortar of the health system. If you have that automated digital follow-up, then patients were also followed up in the tracker, the digital tracker, so that if they didn't come for their consultation in the system, in the health service, they would be called by phone or they would be visited by a community health worker. So that works really, really well. Another low-hanging fruit is that you can improve the quality of care easily if you offer health workers who don't necessarily have access to continuous education like we do have in high-income countries. Health workers on the ground, they are so busy that they need to have help to get better standards in their healthcare provision. So then you offer them clinical decision support systems, digital. This patient has fever and this, what do I do next? And these kind of simple tools really massively increase the quality of care. We've seen, for example, in Sao Paulo in Brazil, where we have that in a very huge urban health initiative, we used clinical decision support, and it improved the rates of people with controlled blood pressure from by 3 times. So in a well-functioning public health system, you can still improve the quality by simple tools like that. So it is really impressive. Others are patient engagement with the tools. If patients need more information on their disease, they need to be engaged in managing their own condition to be successful. That helps a lot. And so we engage them first with SMSs or patients who don't have smartphones yet, or even voice messages for people who are illiterate, and later on with WhatsApp and social media as well. But these patient engagements tools are also hugely beneficial. We've seen impact on the health outcomes of people who do really follow their own disease and are well aware of what their choices should be. So there's a lot of good examples, and we have many others also in the field of AI now with COVID. But yeah, it's again a long answer. Becky, please.
No, that's perfect. Thank you. And I mean, it really is fascinating, and clearly the work and the sort of reach that you have is phenomenal. And I'm sure that, as you said, there are many more examples. And obviously this chat today was designed to give an insight into the work that you're doing, and it's certainly done that. So thank you so much. As I said, if anyone has any questions for you, or would like to connect with you over the platform, please do so. That is the reason that we're all here today, is to sort of grow the community within life sciences and grow our network. So please do reach out to Anne. But Anne, thank you so much for your time today. It has been an absolute pleasure. To everyone watching, I'm sure you'll agree that that was an absolutely fascinating session. And do join us in a few minutes at 1 o'clock for our next panel, which is the role of digital in the transition to value-based care, where we'll have I'm sure another great session with some more fantastic insights. Many thanks.
Thank you, Becky. Bye.